Welcome to Heme Consults Orientation, video number 29. We're talking about when you are in clinic, especially at the VA. I was a fellow at Northwestern, and we went to the Jesse Brown VA, which was a good commute from the hospital. It's probably like a 20, 30-minute drive, depending on traffic. And sometimes coming back from the VA was tough. But, you went to clinic, you finished clinic, and then you still had to come back and cover the consult service. And you're still covering the pager the whole time. It was really rough. So I'm glad when there are opportunities for people to cover the pager for you, and you should take full advantage of that. And let's talk about things that you should consider when you're in clinic and covering the consult service at the same time. Number one, prepare for the worst possible day. I'm not wishing you an evil day. I'm just saying that just be ready. Just say it's going to be hard, and then prepare so that you're not blindsided. And then it may just be that it turns out to be a great day and you were ready and all is well. What's worse is that you were not ready. You thought it was going to be an easy day, and then it was like the 7-patient consult that happened after 3 p.m. after clinic day, and you're like, oh my gosh, I wasn't expecting this. So it's helpful to think this could be a really bad day. And then you ask, how do I set myself up for success? How do I set myself up so that at 12 p.m. I'm leaving the VA, or at 1 p.m. I'm leaving the VA? So those are the kinds of things that I wanted you to think about. And to be honest, I haven't done clinic at the VA for a long time, so I can't help you with that. But I'm saying prepare for it so that you can get ready for it. Okay. The second thing is, what do you need to be ready to leave clinic on time? Is there a bone marrow biopsy that's planned? Do things tend to run smoothly? Do you need to prep your notes in advance? Do you need to just say, I'm going to do my notes later? Don't do your notes later. Or maybe you do your notes later. You got to figure out what works for you. But having a plan so that clinic will be as smooth as possible. And sometimes that's looking at patients in advance, coming up with a plan in advance, talking with the attending in advance to say, this patient is coming and has this problem. This is what I'm thinking. What do you think? And having all your answers together before the clinic day. Those are some things that you can do to set yourself up for success. So definitely consider that you have a lot of options. Okay. The other thing you want to do is think about pager coverage and what does it look like? Now, in general, the attendings will cover the pager while you're in clinic. Sometimes they're in clinic as well. So you're in clinic, they're in clinic. And the covering of the pager, or maybe they're not in clinic, but they have other obligations. So you're expecting that you're going to come back from clinic and all the patients would have been seen. And they're like, oh, I was just covering the pager. And there's, frustration. So it is important to clarify what pager coverage looks like. When the attending says they're covering the pager, are they just answering questions? Are they answering questions and seeing patients? Clarifying all of that is helpful so that no one's surprised. And then once you've clarified, then you're going to say, well, okay, what do we do with the 7 patients who come in after I'm done here at the clinic, but you want to round it too? Many times the attendings do understand and they'll see patients alongside you. What is difficult is if, say, you came back from clinic at 12 and there were 2 consults ready, and then the attending arrives to round at 4, and you're like, oh, I didn't see any patients. And I get it. You're tired, and it's hard to get up and move when you're super tired. And it's also hard as an attending to figure out where 4 hours went and you didn't see a single patient. And so then the attending might be reluctant to help. Like, I don't know if I want to see the patients with you. But anyway, I'm just saying that do the best you can. The attending will work with you and just make the most of it. It fortunately doesn't happen often enough. It's at least only once a week on the consult service, but it is rough. And so you do want to prepare for it. Okay. Now, how will patients be triaged? Say it is a 7 consult day and you're like, I'm not seeing all 7 of them. This is too hard. Talk with your attending. So who are the patients we can defer until tomorrow? Who are the patients that can't be deferred until tomorrow? Who are the patients we absolutely need to see? And that's helpful. And sometimes it'll be that we're seeing all the patients, but we're going to write a brief note on this one. This person we won't see in person. We'll see in person tomorrow. There's always a strategy. Don't try to figure it out by yourself. Just talk with the attending. And for the most part, we're kind of understanding people. We will work with you to make sure it's not a horrible day for all. The other thing is think about your rest and recovery, especially in between the transition from one hospital to the next hospital. You do need the break, whether that's just a 5 minutes, I'm sitting, staring at the wall, thinking happy thoughts, or like a 10, 15 minute, I'm just going to sit and eat lunch right now, uninterrupted, before I take back the pager or something like that. But do make sure that there's a little bit of a break where you're clearly transitioning from one part of your day to the next part of the day. Because even though you're tired, it at least rejuvenates you a little bit. The other thing is think about how you're going to celebrate at the end of the day. It was a hard day and you saw many patients and it took you time to write all the notes. It was a hard day. And it's important to sit, rest, and reflect on the awesome work you did, even though you're super exhausted and wish that the day didn't even happen like it did. But just take time to celebrate your day, take time to celebrate your wins because this is hard work that you're doing. And I salute you in doing it. First year fellowship can be one of the hardest years of training. At least it was my experience. And I'm just inviting you to take time to celebrate your wins the best that you can. Imagine if every day ended with a celebration of a win. How might it change your perspective on the day? I look forward to seeing you in the next video.